Okay, everyone, if you can come in, grab a seat. I know we're still waiting on more folks, but we do just need to, in respect of everyone's time, need to keep on schedule. In a minute, I'm going to introduce our final keynote presenter of the day, but first, I'd like to bring up the CEO of Milwaukee Film, Jonathan Jackson. He'd like to say hi and talk to you more about Milwaukee Film. Thank you.
Thank you, Gerard. Round of applause for Gerard Blanks, Chief Innovation Officer of Milwaukee Film. Round of applause to the whole team at Milwaukee Film. Our organizers of this conference, Maureen Post, I think you're here, I see you. Thank you so much for your hard work on behalf of this community. Milwaukee Film is incredibly proud to present the Black Birth, Maternal, and Infant Health Symposium. And one of those reasons is to support you, to support the incredible individuals in this room working in this community every day on vital matters. And so thank you on this brutal weather day for you to come in force. It really means a lot. I think you should give yourself a round of applause. Thank you. And know that the activity at Milwaukee Film continues year-round at the Oriental Theater. Movies going 365 days a year. And we have an incredible film festival coming up April 20th through May 4th. And this great flyer here has other upcoming activities. But principally, wanted to thank you for being here, for doing this incredible work in Milwaukee, and to acknowledge the incredible team at Milwaukee Film that puts this event on, and without which our sponsors, thank you.
All right, for the finale, it's an honor to have Dr. Jasmine Zapata. I think I might have said this earlier. It's not easy to get on her schedule. She books out months in advance, but Maureen stayed on it. And because, again, part of what's been really nice about this, about today, is that we've been able to bring people like Dr. Zapata, Dr. Green, Dr. Kowalik, Bruce, Omari, and Shani together in this space with all of you. So I'm going to bring up Dr. Zapata, and then I'm going to give the most brief closing remarks ever, because I need to get me a drink and I want to hang out and have a good time. So Dr. Zapata is the Chief Medical Officer and State Epidemiologist for Community Health at the Wisconsin Department of Health Services. Her career includes working as a pediatrician, public health researcher, assistant professor at the University of Wisconsin, and author, and she supports youth empowerment with various initiatives. She is the founder of Beyond Beautiful Girls Empowerment Movement. Dr. Jasmine Zapata.
Thank you. College-educated Black women have 3 times higher rates of prematurity compared to white women who don't even graduate high school. I'll never forget the day when I turned into one of those statistics. I was so excited because I was due to have my second baby on January 2nd. I was a second-year medical student and just so excited about my future. But then all of a sudden, one day when I was walking to class, I felt a sharp pain in my lower abdomen, and I said, something's not right. I called up my doctor's office, and they said, it's just Braxton Hicks contraction. You're just fine. So, being the student that I was, I went to class, and I sat there, and I kept feeling a tight pain in my lower abdomen, and I said, something's not right. I went to the bathroom. I thought it might just be gas, and it wasn't. And then I called my doctor's office back, and they said, don't worry. It's just Braxton Hicks contractions, but if anything changes, let us know. I never forget laying down in the lounge in extreme pain and then going to the bathroom and seeing bright red blood. At that moment, I knew something was terribly wrong, and I rushed myself to the emergency room. When I got there, they asked me how far along was I, and I said, I'm exactly today, 25 weeks pregnant. I just made 25 weeks. And they did a cervical check, and they said, you're 10 centimeters dilated, and your bag of water is bulging. You're gonna meet your baby today. At that moment, I was so excited because I heard the words, you're gonna meet your baby today. But then my heart dropped because I knew it was too early and too soon. Next slide. That day, my life changed forever. I got an emergency C-section and gave birth to a 1.5-pound little baby girl named Amira. Normally, when babies come out, they're screaming and they're crying and they're healthy. But when she came out, her lungs were too fragile and too weak to breathe on their own. They put her on emergent life support. And I'll never forget going to meet her for the first time, looking at how small and tiny she was, not knowing if she was gonna live or if she was gonna die. At that moment, I had two choices. I could either give up or I could keep fighting. It was so hard for me because growing up, I had many adversities over my life. I had parental separation. I grew up not living in the best means, having the most money. I had many young people in my friends and circle of friends die due to gun violence. And when I was in college, my own little 16-year-old brother passed away suddenly in his sleep. 3 months before I took the medical college admissions test. I was still healing from that loss. And then so for this to happen, I didn't know if I had the emotional strength to keep pushing it and making it. I'll never forget the doctors explaining to me how she was doing each night, and then I'll never forget them telling me she had a brain bleed, which was causing her brain to start swelling, and that she would need emergency brain surgery. I remember running out of the room crying, just so distraught. And at that moment, it seemed like problem after problem after problem kept happening with my baby girl. And at that moment, I prayed and I said, God, I don't know what you're doing, but if you save her, I know that I'm gonna dedicate my career to doing everything that I can to combat racial inequities in infant and maternal mortality and do all that I can to save future lives. I knew the statistics. I knew that the #1 cause of Black babies dying before their first birthday was complications of prematurity, which my little baby was right here experiencing. And so fast forward over the next few months, I'm so thankful because of because of my faith, because of the amazing medical team, because of technology, because of research, my support system. She was able to come home and she survived. And now she's 12 going on 21. We can clap for that because she survived. There are so many other birthing people who don't have that same story and don't have that same blessing and experience to say they got to take their baby home. And I share this story just to remind us that behind every single statistic that we talk about, just a reminder, I know that we know it, but it's just a reminder, just like we saw in our Aftershock film, just as we saw in our panels today and our discussions, every single statistic represents a real life, and we must take action in order to change the statistics. So everybody say action, and we can go to the next slide. I want to just briefly share my story of how I took action, and then what we're going to do is have a conversation, because remember, on the schedule it says Keynote Conversation. I'm not just going to talk. We're going to all talk together to end this conference. But it's so important for us not to just come to these conferences, get inspired, feel good, and then leave. We have to remember that there are lives at stake, and in whatever way we can, we must take action. And many of you in here are already taking action because the fact that you are here. But because these statistics are still here, because we still have Black moms and birthing people dying and facing severe consequences, because we still have babies dying, because we still have all of these issues, we must do even more. We must stay focused on our jobs. We must take it to the next level. If we were loud, we got to get even louder, because this is the year that we're going to see change. Do you believe that? Do you believe it? Okay. Let's clap if we believe that. Let's clap if we believe that. Because raise your hand if you ever have felt, and let's be honest, in this work, have you ever felt burnt out or a little hopeless? Sometimes you get numb to the stories and the statistics. You've been probably to hundreds of these conferences over the last couple years, and sometimes it can be discouraging, but we have to remember that together we can make a change, and we have to take action. So I'm just gonna briefly share how that experience spurred me to take action and what I'm doing. And then we're gonna have a conversation together to talk about our takeaways from the conference and what we can do to take action as well. So I had my daughter during second year of medical school, and that fired me up more than ever to continue making a change. Instead of dropping out, which I felt like dropping out of medical school, I continued to keep going. So I was able to graduate medical school, still in 4 years. Even though she was in the NICU for 3 months, I didn't let that stop me. I still was able to graduate from medical school. And right now, less than 3% of physicians are Black women doctors. And so I knew it was so important for me to graduate from medical school. So I did that. And after I graduated from medical school, I decided to go into pediatrics. I thought that I wanted to be the type of doctor that saved little tiny babies going to neonatology. But as I was in the field of pediatrics, I realized that there are so many social determinants of health that impact families. I decided to, after I got trained as a pediatrician, to go into the field of preventive medicine and public health so that I could step outside of the clinic walls to make a change. That was my way to take action. I just kept following my heart for the next step. Only 20% of birth outcomes, 20% of health outcomes are even based on what happens in the hospital and clinics. 80% is based on individual behaviors, social determinants of health, your environment, social and environmental factors. So it's so important that we all work together on this issue. So I had a calling. I got to get out of the hospital walls so that I can really make a change. And so after I got my preventive medicine training, I accepted a job at University of Wisconsin to do research on maternal and child health equity and listen to the voices of Black women. Who believes it's important to listen to the voices of Black women? Yes. I love that conversation we had earlier today about the importance of research and evidence-based medicine, but also the importance of Black women's voices. We have to listen to Black women. So I started a research project in a research endeavor interviewing Black women up in Dane County about, from your perspective, what is needed to make a change, to change these statistics around. What do you need to be supported? And that research is actually getting published this year, so super excited about that. Yes, yes, yes. And a lot of what they're saying, we already know, but some of the highlights are we need more, and if you agree with it, let's clap too, so we can know that what they're saying is important. We need to increase diversity in our healthcare and medicine workforce. We need more Black doctors, more Black doulas, more Black midwives, more funding to support community-based organizations. And also, one thing that they mentioned that really came out that was so important, they said in order to rebuild trust, they need people to understand, especially within healthcare systems. One powerful woman said, I want the doctors and the nurses and the people in the healthcare system to treat my anger the same way as you would a white woman with tears. Woo! And that was powerful because I, as a medical doctor, have gotten sign out where you take over a patient. And then the comments that I'll get sometimes before I even walk in the room can bias you. Oh, this is a difficult patient. Have fun in there. And I walk in, I literally know their whole background and demographics as soon as I hear the sign out. It's so sad that that happens. But sometimes when, this is the comment that individual said, she said that sometimes, a lot of times, Black women have had to suppress their feelings and their emotions and be so strong. So when you're in labor and you might be scared or you might be in pain or you might be worried about something, it might come across as tough and hard and intimidating, so then others get scared or walk away. But if it was a white woman who was crying because she was scared, what happens? Where do you think all the nurses are going to run? Into that room to help her feel better. Now, of course, that's just one example, but that was what she said. She said, treat my anger the same way you would treat a white woman with tears who's giving birth. So that was powerful just to understand the importance of listening to the voices of Black women. They also mentioned that they wanted more time with their providers, because in addition to a lot of the social determinants of health work that we need to do, guess what? And I can say this because I'm part of the healthcare system. We need to reform the way that we do medicine, that we treat Black bodies, that we take care of people. It's so, so important. And so it was just so powerful to hear their words. So that's one thing that I did as far as taking action and that I'm still doing. And as I talk about what I'm doing, I just want you to start to think about and celebrate the things you have already been doing and what you're going to do moving forward. So I did that research. I ended up working. I work as a newborn nursery doctor. I'm the only Black newborn nursery hospitalist at our Larging birthing center up in Madison. And sometimes I want to quit. I'm not going to lie. Sometimes I want to quit because it gets hard. I've walked in rooms where people will think I'm there to deliver the food, or I use my badge to get in and people follow me down the hall and question why I'm there. And I'm like, excuse me, I'm the doctor. I'm here to take care of patients. Or sometimes I'll be talking to a patient and other doctors, I won't list their backgrounds, but they'll walk in, completely interrupt me and disregard me until I have to say, hi, I'm the pediatrician. Oh, we're so sorry. There's been so many things that I have experienced that made me want to quit, but I don't quit because I know that representation is so important, so that when we have patients in the hospital that are needing help with advocacy or just to see somebody that looks like them, they can feel a little bit more comfortable. And so that's why I'm still there, and that's one form of action. And then over the last 2 years, I decided to take it even a step more, and I accepted the position to be Chief Medical Officer and State Epidemiologist for maternal child health and chronic diseases for the state of Wisconsin. And I had to look back through the history, but I found out I was the first Black Chief Medical Officer for the state of Wisconsin in its whole entire history. And so that's my form of resistance. That's my form of pushing back. And then I had with that role, I get to do so many amazing things. And one thing that's so powerful is that, and this goes for us in the room too, especially those of us with lived experiences, everything that happens in your life is meant for a reason. Everything that happens in your life, it might be painful the moment that you're going through it, but everything that happens for your life is meant for a reason. And so when I took that job as Chief Medical Officer, now in our bureau that I help to lead, we have the Women Infants, the WIC program, which I was on WIC when I was growing up. Now I'm in a position where I'm helping lead it. We have our entire maternal child health statewide programs. I get to work at all levels to help oversee millions and millions of dollars that are going to solve the very maternal and infant inequities that I experienced myself. It's just so amazing to understand when I look back at my life now, how all of those things needed to happen for a reason so that I can be the leader that I am today. And I want you all to remember that as well. And one other thing that's just so exciting is in that role, I get to be the co-chair of the Maternal Mortality Review Team. And shout out to our members in here. And again, I had to look back through the history books like, I'm making some history here. In the 30 plus years of existence in our state of maternal mortality review, which we do see 3 to 5 times higher rates of Black maternal mortality. I'm the first Black co-chair in the state's entire existence on the maternal mortality review team. And so the reason that I'm saying, and it's not been easy. Every job that you do has its turbulence and hard times, and there's been times I wanted to quit, but I don't, because this is my form of civil rights and resistance. In that video that we watched earlier, do you remember how they didn't even allow Black doctors to go to medical school to admit patients? Even though it's hard, that's my form of resistance. And again, I'm sharing all this with you so you can be inspired to whatever your fight is, whatever job that you're doing, know that even though it's hard, even though you want to give up sometimes, you're making a difference. Collectively, we can all make a difference. Remember, we talked about Ubuntu earlier today. I am because we are. Who believes that? Yes, I know that I believe that. And then finally, one more thing that I want to share that I'm so excited about, because it's really important that we don't get burned out as we're doing this work. And it's so important to, as we're working to solve these big problems, to invest in our future generations. Can we go to the next slide? So one other thing that I have been led to do in my quest to annihilate racial inequities in maternal and infant mortality is to understand the power of investing in our younger Black girls in order to prevent future adverse birth outcomes. Let's clap for that. Let's clap for that. A lot of times we talk about what we can do for Black birthing people once they get pregnant, which is amazing. It's so important to focus on social determinants of health, to focus on screening, to get them a doula. All that stuff is extremely important. And in addition to that, one area that I believe has been lacking, especially in the reproductive justice movement and with healthcare systems, public health systems, as we work to solve this problem, is that we need to, in addition to all this wonderful work, we need to go upstream. We need to focus on prevention. Raise your hand if you're familiar, which I know mostly everyone is, with the Adverse Childhood Experiences Study. I'm not even gonna go through that again. But basically, we know there's research that shows, even research right here in Wisconsin, that looked at almost 2,000 records. Women who experience adverse childhood experiences or trauma or adversity as a young child, they have higher rates of cardiovascular issues, higher rates of high blood pressure, higher rates of mental health issues, higher rates of preterm birth, higher rates of death, and adverse birth outcomes. That's the very thing that we're working to solve. And the higher your the higher your ACE score is in childhood, the higher risk that you're going to enter into pregnancy in a state that makes you more vulnerable. So if we really want to make a change, in addition to all the amazing things that we're doing right now, we have to invest in our young children, because they're going to be the ones driving the statistics 20, 30 years from now. What are ways and what are things that we can do to strengthen families? What are things that we can do to prevent childhood separation from their families? What are things we can do to prevent a parent from leaving the home because of incarceration? What are ways that we can prevent rapes and abuse? What are ways that we can focus on investing in our young girls? Also, in this society and what we're facing right now, especially in the healthcare system, Black women are devalued. Black women are not, they are not empowered as much as they should be. And so what we need to do is for these young girls that have experienced adversities, which racism alone is an adverse childhood experience. we need to be able to support them at young ages so that we can reverse and prevent some of the negative health consequences. And that's why, in addition to the other things that I do, I started the Beyond Beautiful Girls Empowerment Movement, where we teach girls that you are more. And this applies to all y'all in here too. You are more than what people see on the outside. Your true power and beauty and strength is on the inside. Do you believe that? Yeah, we have to believe that. There's so much pressure that young girls face, especially during COVID, especially with everything going on. So we work on empowering young girls through the power of spoken word, poetry, music, and singing. I actually wrote songs related to girls' empowerment. Next slide. We have a lot of partnerships that we have done with the YMCA and other organizations to focus on empowering young ladies. And it's just so amazing. Many of these young ladies come in with the burden of the world on them. And so teaching them how to advocate for themselves, to know that even when the world tells you you're not gonna make it, you're gonna fail, you're ugly, treating them differently because of racism. Chronic stress over a lifetime is something that we know leads to poor birth outcomes. What can we do to intervene when these young girls are 5, 6, 7 years old? We have to combat the negative stressors that this world is putting on them so that we can prevent the negative outcomes in the future. So that's another one of my forms of resistance, and I'm just so excited for that work that we're doing. I'm going to read just one little poem that is in the Beyond Beautiful curriculum, just so you can see the message that I am declaring to all of these young ladies and all of the Black women that we have here today. I believe in the power of our words, and the things that we speak are so important. There's so many negative messages out here right now about Black women, the way Black women's bodies are treated. And this is just a reminder that because I'm a Black woman too, and I got to remind myself of this, we are strong and we are courageous. We're more than what people see on the outside. Our true beauty is within, okay? Actually, you know what? We're all going to say it together. How about that? So everybody stand up. Everybody stand up. Everybody stand up. Me. And this is what we do with the young ladies, and it's just an example of different and innovative ways to encourage our young people, because they're going to be driving those future birth statistics, and we need to empower them to make a change. So it starts like this. Today will be a great day. I'll achieve all I set my mind to. I cannot be stopped. I can do anything I want to. Because I'm beyond beautiful. I'm beyond beautiful. I'm courageous. Hold on. Now, this is what I tell the young people that I work with. When you say it, how should you say it? Should you say, I'm courageous? Because I don't believe y'all. You have to say it with power. I tell my young ladies, I say, there are so many statistics stacked up against you right now. So many people speaking negativity over your future. But who has the power to speak power and life over yourself? It's you. So when you say it, you got to say it like you mean it. So we got to just try it one more time. I'm courageous. I'm resilient. I'm confident. I'm creative. I am talented, intelligent, unique, and innovative. I'm worth it. I deserve it. I am treasured, and I am loved. I deserve every blessing that is coming from above. Now, if you believe that, clap your hands for that. Clap your hands for that. You can sit down. You can sit down. You can sit down. And I dedicate that too to all the Black birthing people in our system right now. We are worth it. We deserve everything. And it's just such a powerful message. So next slide. So what we're going to do for our last little bit of time together, I just want to get a couple volunteers. I'm going to come down, and I want you to say boldly what you are going to do to take action in this next quarter. What you are going to do as a result of something that you learned here today. or are recommitted to doing. I want to know what type of action is going to happen from this amazing, amazing event. Let's give one more round of applause for Milwaukee Film for hosting this amazing, incredible event. We are not going to let this be another conference we just come to, feel good. We're going to use this to ignite our fires. So who wants to go first? I'm just going to come around, or I will pick on people. I'm known to do that. Okay. All right, let me come back here. And when whoever says what they're going to do, the only rule is when they're done, I need us to clap for them and cheer like crazy. We got to pump each other up, right? We got to support each other. We have to all work together. So, okay, come on, stand up. Say your name and say powerfully one action that you are going to do to continue this fight.
Thank you, Dr. Jazz. Hello, everyone. I'm Tori. I'm with Milwaukee Health Department and with their Bomb Doula program. The action step that I'm going to take that I've been putting off for a while is I'm going to begin my midwifery training.
Oh, my goodness. Yes, yes. Who else is next? Let's go, let's go. All right, here we go. And if you know these people that are saying it, we better hold them accountable, right? Okay.
Okay, my name is Dalvery Blackwell. I serve as the executive director and co-founder of the African American Breastfeeding Network. Dr. Zapata did give me an assignment, but I'm not going to mention it to everyone. Okay. But my commitment is to follow through on the meeting that's coming up that we had in our workshop, that just making sure that I'm committed, I have integrity, and that I'm being in that space that's asked of me. So.
Yes, let's clap for that. Okay, I'm feeling to come over here. Somebody over here has something. I know it. Okay. There we go. See? You guys got lucky.
My name is Nicole. I'm with the Wisconsin Association for Perinatal Care. I have my team right here. And we're going to be getting more lived experience and living experience in our quality improvement initiatives across the state.
Yes. Let's clap for that. That's huge. All right. Come on. I need some more. We need to hear some more. Who's going to go? Back here? Okay. Here we go.
I'm Kwanzaa Devlin. I'm a family medicine physician at Frederick Menominee Falls. And my action item is actually partly coming off of that piece, but being a place to kind of be a conduit for connecting patients and patient stories to other works. So be that in, right now we're looking at the medical college is redoing their curriculum and getting patient involvement in that process so that the stories change. If the education changes, the physicians change, can we change the outcomes, as well as connecting with groups like our last speaker, and how do we connect patients to these things so that things are actually happening. So that's my thing.
Yes, that's huge. On top of what you're already doing, because let's clap for our family medicine doctors. That's not an easy specialty. In addition to that, you're about to do all that. That's amazing. All right, I got to hear from somebody back in this corner. I feel some good stuff happening back here. I think I want to hear from you.
Oh my gosh. I'm Sheena. I am the manager for the Milwaukee County Healthy Start program. And I'm not sure, like, my bigger action step, because I need time to process before I make a commitment to what I want to do so I can make sure I follow through. But I do have an action item that came out of our breakout session. So that is my immediate takeaway, and that is to kind of follow up with some schools to figure out some parent engagement models that are already successful, and how do we kind of help to implement that in other schools.
Yes. All right. Woo! All right.
Yeah, thank you very much. My name is Doris Richardson, and I'm with UWM. I'm a nurse, a midwife, and a health educator. And I'm an international student here doing my PhD, and I'm so touched about the things I've heard today, and so amazing. So I'm going to do everything that I can to educate more midwives, to support in whichever way. Thank you.
That's powerful. That's powerful. All right, I'm making my way to the front. Okay. All right. Here we go.
I'm Johanna Nevin. I work with the wonderful Tonda Thompson, who could not be here today. And I have been wanting to for a while, but I'm committing myself to it now, to have an accountability space for white folks that are in this work, because it doesn't matter how well-intentioned we are, and that's the end of that sentence.
Yes, that's important. Let's clap for that. You need to start your sign-up sheet. You start your sign-up sheet today. All right. No, let me stop before I get kicked out. All right. We have one over there. How about you stand up and just start saying it right now? Because by the time I just start talking. Yeah.
Okay, I'm pretty loud. Hi, how's everybody? My name is Teron Edwards. I'm from Fathers Making Progress, and through our session, we came up with, 4 work groups that are going to be really, really intentional about action steps, and how our community heals our community, how our fathers and families heal our fathers and families. And we're going to be really intentional in not just talking about it, but being about it. And I just felt the need to get up and to say that, because a lot of people in this room know me. And when y'all see me a year from now, y'all can say, what's up with that?
Awesome, awesome, awesome. All right, we'll go here and there, and then we'll wrap.
Well, Teron, I'm going to call you out on our meeting we need to have, but we okay. But that's another side note. Hi everyone. My name is Sarita Valmon. My business is I'm Chronically Resilient. I'm a chronic pain coach and wellness consultant, and so my goal is to launch my Intro to Holistic Pain Management program that is called the Alleviation Agenda. So if you guys know of anybody, come my way and let's talk about it. I'm launching it the first week of April.
That's powerful. That's powerful.
Hello, anybody. A lot of people know me as now Dr. Yvonne Greer, and I'm a registered dietitian, and I am lead of MCOP, the Milwaukee County Organizations Promoting Prevention, and we have a social determinants of health accelerated action plan for Milwaukee. We'll be hosting a town hall meeting on it, and everyone is invited, but we want to take it to a next level and develop community health action teams throughout Milwaukee, and we're going to try to make that happen, to bring the voice of the community into these settings to make sure what they want and what they want to see is actually what gets implemented. But I do want to say I want to support the Nurturing Collaborative, which is a brand new program, and I'm going to put this person on the spot who just happened to be my daughter.
This will be the last one.
Wow. The Nurturing Collaborative. So my name is Vanessa Johnson. I'm a reproductive health OB nurse, a doula birth worker, yogi in the community. I launched an initiative with Feeding America. We launched it in January. And so the goal was to bridge the gaps between food access, food equity, and families who are on their perinatal journey. And so it launched. We are in full swing. We have funding to serve 200 families. We did a soft launch, so we have about 80 already registered, but there's 3 components to the Nurturing Collaborative. One is every month through December, they'll get what I'm calling a nourishment box. It's a box filled with healthy, nutrient-rich foods with recipes curated by Dr. Greer, so I know they're good because they're my mama's recipes. And other additional food access resources in those boxes. We're using DoorDash, so it'll go right to them, and it's been successful thus far. The other piece to the Nurturing Collaborative is the nurturing boxes. It was really important for me to provide tools for stress reduction and relaxation. And so I reached out to our wellness providers in the community, creatives in the community, and all of these amazing creatives responded and are contributing to the nurturing boxes. So in those boxes, there are things like aromatherapy candles, affirmation cards, reflection journals, bath bombs, bath salts, things to really allow the mom or the birthing person to relax and just kind of woosah during that time period. The last component to the Nurturing Collaborative are the workshops, which will be starting in April, targeting 5 components of social determinants of health. So we'll have mental health therapists coming to talk about postpartum mental health and wellness. We'll have Dr. Greer come and do live cooking demonstration, tying in the recipes and the foods from the nourishment boxes, and really doing a deeper dive into the nutrient component of healthy foods during pregnancy and postpartum. We'll have the doulas come in and do childbirth 101, movement modality, exercises and things to help them along their pregnancy and postpartum experience. We will have Sister Melissa Blue, for those that don't know, amazing sister in the community. She's a Reiki practitioner and a sound healing practitioner to come and do sound healing therapy sessions with the families. And she facilitates a self-care, self-love, self-worth curriculum. And then the fifth workshop would be a community resource fair, where we're asking community partners to come serve the families, introduce them to your offerings. And again, those will happen every quarter through the end of December. So thank you.
Yes, let's clap for that. That's some action, all right? And sometimes it's important to come in front of people publicly and cast your vision, because in 10 years, you're going to be on national news talking about exactly what you said right there. So we're so proud of you. So last thing, as I hand it over, put your hand on your heart and say, it starts with me. Let's say it one more time. It starts with me. Yes, thank you so much. Here we go.
Thank you so much, Dr. Zapata. That was the perfect way to end our time together. Was that your cell phone? My bad. All right. So it actually does a lot of my work for me. So my ending remarks can be rather quick. I know it's kind of hot in here, but nothing that a nice whiskey on ice won't fix. I'm joking. So again, I just want to reiterate, I want to go back to the quote from this morning. Good looking, thank you very much, because I wasn't going to find it. I really hope all the medical facilities get on board with this event. They say this is the most important issue impacting Black women, but I don't see everyone at the event. Our community watches to see who puts their money where their mouth is. This also helps build trust in our communities. We don't need another billboard ad. We need your dollars to go to these events, to go to events like this that really make an impact in our communities. We are watching. With that said, I want to call out, okay, I need to get off stage. I want to call out all of our sponsors one last time. Planned Parenthood, Milwaukee County Office of Equity, Milwaukee County Department of Health and Human Services, Chorus Community Health Plans, City of Milwaukee Health Department, Freighted and the Medical College of Wisconsin, Children's Wisconsin, and the Bader Foundation, as well as BCDI, United Way, GE Healthcare, and WellPoint Care Network, and Greater Milwaukee Foundation, which has been a supporter of ours since the beginning of this process. So, quickly, we have some winners of the contest. Did y'all know there was a contest going on? Well, most of y'all didn't win. So, I mean, that's how these things work, right? Okay, so we have our top three on the leaderboard. Hazel Jones, Kwaku, D'Angelo Cargile Jr., and please correct me if I say this wrong, Teresina Simmons? Is that? Well, she's not. I'll keep her prize. So come see me afterwards. Also, Mario Drain, I owe you a prize from last year. So hopefully. And then our winner of the photo contest, actually Mario tied with Emily Jacobson. So come get me after I've gotten my drink, and then I'll give you your prize. Last but not least, next steps. I know everyone wants to know, what are we doing next? So first and foremost, is everyone familiar with the conference next month? Okay. The Foundation for Black Women's Wellness, 3rd Annual Virtual Black Maternal and Child Health Summit. Registration is open now, and it takes place Thursday, April 20th from 9 to 3. So you can go to ffbww.org/BMCH Summit. And I'll post that information to Hoover, because you don't remember. So here's the thing. The Hoover site, the Hoover app, will be active through the rest of the year. Part of what we're trying to do is use that platform as a way to communicate. Also, since we have everyone's email, once we've had a time to collect all of the notes, we're going to check in with a lot of the work group facilitators, collect the notes, check on the audio recordings. Hopefully they turned out. This is our first time doing it. And we're going to see what we have, and then we're going to figure out a way, in concert with many of you here, on how to archive that information and give people access. The whole idea of the Black Birth Network, Black Birth Initiative, whatever you want to call it, is for the symposium just to be a launch pad, right? To bring all of you together to network, and now let's figure out where we go next. Many of you already have meetings on your calendar as of today, but the sharing of ideas and the sharing of events is what this is about. So we will keep in contact, and our idea is that we'll be sharing information throughout the next few months, but sometime in the fall, we're going to create another gathering. It will not be another symposium, but it will be some sort of social gathering where we can bring you all together, have updates, and talk about who's going to do the symposium next year. Because I'm retiring, Maureen. Thank you to Maureen Post, Erica Peterson, the whole Milwaukee Film team, staff, record label, and crew. Thank you to St. Kate. Thank you for everyone coming out. We have DJ Drip Sweat in the hallway. You're already sweating. See, she gets me. And we have hors d'oeuvres, charcuterie boards, and that's it. So hang around, let's talk, and thank you so much for coming out. God bless and good night.